Hello, and thank you for joining us on the Stay Healthy Knoxville podcast, brought to you by Simply Physio, aimed at helping you live an enjoyable, fit, and healthy life in and around our community of Knoxville, Tennessee. And now, here is your host, Dr. John Mark Chesney.
Hey guys, I'm super excited about our episode today. Today is going to be a little different format of what we typically do. So on the show, I have joining me Dr. Nathan Chesney, my brother. He was the guest on our show, I believe it was episode number either 3 or 4, where we were talking about dental questions and how to have a good smile. So the topic of today, we're going to be talking about a TMJ disorder. And ultimately, Dr. Nathan Chesney, my brother, myself being a physical therapist, we both are involved with this joint, and we come from different trainings, with him being a dentist and myself being a physical therapist. And so we want to talk about just the nuances of this joint, of the syndrome of TMJ pain, and we may have some varying levels of opinions or differences in thoughts and things that we do agree on, but we want it to be just a resource for the community who people suffering from TMJ pain, so that you can have some guidance and understand, hopefully have some clarity on what to do next, who to seek, and ultimately have some resources that you can go to help find some answers for this condition. So a little bit more about Nathan. So Nathan is a practicing dentist here in Knoxville. So Chesney Dentistry. They have 2 locations in West Knoxville and Farragut, where Nathan serves currently 1 day a week, and he's the primary dentist at their location in Fountain City. So Nathan, welcome to the show again.
Yeah, thanks for having me again.
I know we've talked a little bit about TMJ and have collaborated on some cases, so excited about talking more about the condition. Mm-hmm. So yeah, that we can help other people. But yeah, and I know when we talked earlier about, just recording the podcast and TMJ, and I was asking you about, some of, like, even in dental school, like what is presented in dental school about the joint. And so I'm interested in that. And oftentimes, the joint itself, like if somebody has an issue with TMJ, the first question that I find is who should they see? There's so many, it's this kind of this nuance of a joint that doesn't really fall into somebody's, a professional's lap per se, right? You have your dentist, you have, primary care physician, you have physical therapist, a chiropractor, ENT. And so you have all these different professions that can help and assist with this disorder, but it creates further complexity around it as well when there's not really a clear consensus to, for the general public of who do you see. If you have teeth issues, you go see a dentist, right? Hopefully if you have back issues, you come see a PT. But the jaws kind of just falls in this in between. So would be interested in hearing a little bit more about what's presented even in dental school.
Well, they present quite a bit of information about it. There's a lot of theories of why you get pain, and they just go over the complexity of the joint. I think it's a ganglioarthroidal joint is what it's properly labeled as. It hinges, slides, and glides. So it does so many different movements. And then it has a disc in the middle of all that, which can get damaged. And so, there's so many different ways you can go about treating it, or so many things that can go wrong with the joint, and different ways to treat it. And so it's just it's a very complex joint to treat. And so I think it might have been another student that told me, or it was a professor that said it's like the voodoo of dentistry. And so just a lot of people have differing opinions about how to treat it or what to do with it.
Even in the field of dentistry, I take it there's people can go into the specialty. Is there a specialty designation for a dentist who works specifically with TMJ?
You could probably go to continuing education for TMJ disorders, but usually the oral surgeons are the ones that get the bulk of that. And they're the ones that really, really treat it. If they have to do surgeries, sometimes they take out the joint and it almost builds the joint back by itself by not being just with scar tissue. They do if it gets to that point.
Right.
And
Hopefully not.
Hopefully not. And they're the ones that get the bulk of the training.
We talked about, discussing even the causes of TMJ, and you mentioned the disc and just the complexity of what did you call the joint? The
ganglioarthroidal.
that term, and just how it is a unique joint in itself, and it's a joint that is used every day. Just understanding from your perspective, certain other things that can cause TMJ. I see certain things in particular in my profession that I look out for because that's what I can treat for it when it's caused in certain ways. But are there certain characteristics that you've seen that contribute to TMJ pain?
It's arthritis is where the joint can break down.
Sure.
And so I'll see that. And a lot of the other times I don't know why it's doing what it does.
Right. Do you have a way of determining if arthritis is that impacting the joint?
I don't myself, I guess, diagnose it if it's the arthritis that's doing it. People come to me and I can tell them, yes, there's a problem with your joint, and then you need to go see someone.
Right. And I mean, the common symptoms that, that I see, even talking about what causes it, and we can talk about the symptoms, people have. Typically what you'll see people come into your office complaining of.
They'll have clicking and popping. Sometimes I'll feel their joints dislocate. And so I've yet to have a patient that's had a locked jaw that I've had to set in place. But there's a way of putting that back into place. They'll come in with we're just worried that their joints clicking, and sometimes I'll feel it, and sometimes it's really bad, but they're not having pain. And so I encourage them not to pursue treatment at that time unless they really want to, if it's not painful.
That's what I find too with, other joints that pop, your knee pops, your ankle pops, your neck, maybe pops. And ultimately how I view popping is it's better for it not to pop. We'd rather it not pop, but we don't need to set off the alarms if something starts, popping. But it could be a precursor to it becoming symptomatic as far as pain. Typically, is that what you'll find too, that it starts popping first?
I guess so. Yeah,
sure. And that's what I'll see too. And so it's not that it's at a point, some people can, live with a jaw that just pops.
Yeah. Some people have it just popping for
right. And it doesn't, progress to a serious condition, with pain. But again, the pop is something that's abnormal, right? It's not ideal. And so it's a sign, that there's abnormal pressure movement, happening there at the joint. You talked about the disc, right? As part of the joint, and ultimately the popping is when the mandible, the head of the mandible is how it's positioned over the disc creates a pop, and when the jaw typically opens, the disc will slip and it'll create that popping sensation. And usually when the jaw closes again, it relocates that disc itself, creating ultimately that sound. So that's a common symptom is we talked about popping of the jaw, also just pain around the jaw, and a few things we get a lot of referrals for TMJ that people may go down the route of seeing an ENT. And oftentimes it's interesting what people will have is they'll complain of ear pain. And so then they think they have fluid in their ear or something's wrong with their ear. They'll go see the ENT, right? Who can check out their ear, and they'll have their ear checked out, and the ENT will tell them hey, there's nothing wrong with your ear. It passes, there's no fluid. And they'll, look at around the jaw and, see, hear clicking or diagnose some sort of clicking or tension around the muscles. At that point, they'll tell them that they have TMJ, a TMJ disorder. And oftentimes people are a little bit shocked because they're complaining, they feel it in the ear. And that's some of the nuances or the voodoo piece of TMJ. A lot of people don't even realize that they may have, TMJ because of all that's located around that area, the jaw, the ear, the neck involved with that. But
some people will come in they'll think it's tooth pain, but it ends up eventually when I get over and I start checking their teeth and stuff, and there's nothing really wrong with their teeth, and then we'll we'll come to a conclusion that we think it's coming from the jaw more.
So yeah, sometimes it's a diagnosis of exclusion, right? Like it's we checked out the ear, it's not the ear. Checked out the tooth, it's not the tooth. What else is in this area? Hey, you're having some clicking. We can palpate the area around the jaw, and there's tension in the muscles, and can conclude that they likely have TMJ. So I don't know if you've had patients come in with limitations in how their mouth opens, like how fully they can open their mouth. Is that you obviously have to get inside their mouth to work on on their teeth?
Yeah, that people do come in with different limitations. But when they've gotten to that point, usually they just have limited opening or not. I don't think it's as much related to the joint. When
certain types of TMJ symptoms, like when somebody opens their mouth, like the jaw will deviate. Like you'll see the jaw actually do like a C curve. Sometimes it can do more of an S curve. Usually it's more of like a C curve. It'll deviate to one side, and it's a sign when the jaw deviates, let's say to the left, that there's more tension on the left. There's less movement there at the TMJ, and so the jaw will go towards the tighter side. But there's other symptoms that I look for as well that are very common with TMJ pain, and usually a question I'll ask next if they have suspected TMJ is, do you have neck pain? And more often than not, people also have a history of neck pain. And the other question I'll ask is, do you suffer from headaches, like some sort of frequency of headaches? And it's more often than not that there's that's a positive. They say yes as well. And again, it goes into the nuance of the joint. Is there's a lot at play at the TMJ, and it's not just what's going on at that joint itself, but what we'll find is there's an association with the neck, the head position, a lot of the muscles that go up towards the head and the neck. They stretch over multiple areas, and the position that your head's in will influence the pressure and tension around the jaw. And many people gravitate, like the head starts gravitating more in a forward position, to think about just like your posture. If you have poor posture, your shoulders are rounded, your head comes forward a bit. And ultimately what happens when your head comes forward, your jaw gets pulled back further into the temporal bone. So TMJ is the temporal mandibular joint. But when your head comes forward, the jaw gets pulled back, and it creates increased pressure there at the joint that can create more issues with how it moves. So we talked briefly, Nathan, if somebody's coming in and let's say they have mild symptoms such as like their jaw, like they just have some popping or clicking there at the joint, but if they're concerned about it, what typically route do you take with educating them or advising them in that regard?
I tell them that the clicking and popping isn't bad per se, but it's when it's painful that it's bad. Some people come in and it hasn't been hurting very long, and so I usually just tell them a few exercises to do, just to exercise the joint, put some heat on the joint as they exercise it, take some NSAIDs, ibuprofen, because there might be some inflammation going on in the joint, to try that first before leaping to other things that could be irreversible. And so that's what I do for the more mild symptoms.
Oftentimes, if it is, something that's what we find, if it's just been going on for a short amount of time, just been going on for a few days or maybe a week or two, when you catch it early, then the solution can typically be a lot more simple, like such as, like Nathan said, with using a warm compress and, just doing some movement, some self-massage around the joint, around the muscles, taking some ibuprofen can, just to calm down the area. And if it's something simple, then oftentimes it can, resolve itself. Ultimately, like any other pain is, a back pain or shoulder pain, like if you catch it early and you provide some sort of modification of activities, oftentimes it'll work its way out. Are there certain things that you'll advise as far as eating?
We'll tell them not to chew gum for a while, to just give their joint a rest. And that's the major thing. softer foods.
And that would be the equivalent of like, don't go lift heavy things if you have back pain, right?
Mm-hmm.
Don't go chew repetitively on a tough steak. Like that's kind of like lifting 100 pounds for your back is like, if you have a jaw issue, chewing, a tough steak is equivalent for the TMJ. So those are, real simple things that if you're listening to the podcast and even if your symptoms are worse in severity, it can be a good place to start it may not cure your symptoms, but it can likely help at least start to give you some relief, modification of what you're eating, avoiding chewing gum, watch hard candy, anything that, even how a thick hamburger, having open your mouth real wide and having a short period on a softer diet, where, you just don't have to work the jaw as much. When things are getting, let's say somebody has symptoms that are more severe, what do you do next? What do you recommend? Or if let's say that they just don't respond to the more simple suggestions.
I'll do my examinations again where I like palpate the joints, and I'll feel the joints as they open and close, and feel that popping or clicking, and then know that something more serious is going on and they're having that pain. And then usually I refer them to an oral surgeon. We have one here in town who he's really good with the joint. He starts off very non-invasive. He doesn't like to get invasive at all, and so he starts out the least invasive that he can do. And if he has to work his way up that chain, he does. But he has a real good treatment philosophy with that.
Ultimately, surgery should be like the last resort. You would agree with that?
Yeah, usually the people will come back, and if it's real bad, and they'll be like, the surgeon told me there's a 50% chance that it could get better, or 50% chance it could get worse. And so
with surgery,
with surgery.
Yeah.
So
what we want to do is we have really our top 10 questions that we're going through. We've kind of gone back and forth and answered about the first 5. And I'd like to take a quick break and hear a word from our sponsor. And when we come back, we're going to talk more about more severe cases, like if you're not improving to a simplistic approach, what are the next steps that you can do, what you can do to hopefully avoid surgery, and to find full resolution of your TMJ pain.
Stay Healthy Knoxville is sponsored by Simply Physio, a physio clinic that equips and empowers you to live your life to the fullest so that you can enjoy the things you love to do and be the person you are made to be. Simply Physio specializes in helping people get back to a healthy and active lifestyle, living free from pain and medication and avoiding unnecessary surgery. Stay tuned until the end of the episode to receive a special gift from Simply Physio and enjoy listening to the rest of the episode.
Hey guys, welcome back to Stay Healthy Knoxville. We're deep into our conversation about TMJ pain here with Dr. Nathan Chesney and myself, going back and forth a bit on how we look at the joint and how we can potentially help you find some solution, find some answers to this condition. So I wanted to talk a little bit about night guards and splints, Nathan, and tell us at what point would you recommend, or what factors are you considering when you would recommend some sort of night guard?
Well, I'll have patients come in, and a lot of times I can just notice from their teeth certain wear patterns. They'll have, it's called facets in their teeth, little holes in their molars, and their anterior teeth will be kind of ground off lower. You've probably seen people like this where their teeth are just a lot smaller. Just from grinding at night. Some people don't even have symptoms when they have those things going on, and so it's just more for protecting their teeth. And some people come in with really bad pain. I did have one person come in that was having real bad pain at night. It was just really exacerbated, and she would wake up at night and we were having a hard time talking with her because she was deaf actually, and her mom was trying to translate. We kept running all these tests. We couldn't find anything, and eventually we landed on doing a night guard, and which helped a whole lot. So the questions I'll ask if a night guard's going to work for them, I'll ask them if they wake up with their muscles are sore, or if they wake up in the middle of the night with jaw pain, or if their teeth are sore. And those are probably the big questions that I screen for.
Sure.
And then I'll couple that with how their teeth look to see if they would benefit from a long-term custom fit night guard that we'll take an impression for, or maybe if it's just a period of stress they're going through, and I'll tell them just try over-the-counter night guard, because a lot of people don't want to invest in the custom fit night guard I've found.
Yeah. Those are some of the same questions that I, look forward to is, how are they over the course of the night, right? Or first thing in the morning. And, if they're waking up with a lot of just tension and, just around the face and the jaw, that's a strong sign that I would consider they're likely clenching at night. And yeah, like you said too, is sometimes people can go through like a period of maybe a stressful situation. And I remember when I was starting my practice about 3 years ago that, there was a lot of uncertainty and just, stepping into a new frontier. And I remember I would wake up and in the morning and just like the same thing I'd recognize, like just having like tension kind of through my jaw. And it never happened before. And I do have a mouth guard. I don't have any TMJ pain, but I've had some, I guess, patterns of some receding gum line that can come from clenching, right? Your teeth. And so got a custom mouth guard, which I need to wear. I got in the habit of wearing it, and then it got out of a habit. I guess it doesn't do much good, does it?
Nope.
When you're not wearing it. Just like prescribing exercises doesn't do much good if you don't actually do them. But probably the worst case of wearing down of the teeth, and I don't know if you would agree with this, Nathan, was a fellow by the name of Dudo.
Oh, yeah. Forgot about him. He was my dog.
That's right.
He chewed on rocks.
Yes. And how was Dudo's teeth?
They were not really there.
Right. That's the dog we had growing up. We got from as an adult. He was, I guess, from the pound, and he had this.
They did a rescue, I think.
Rescue, yeah. In a habit of chewing rocks. So if you're listening to the podcast and you have a habit of chewing rocks, like Dudo, that would be the first step. Is don't put rocks in your mouth. We couldn't convince Dudo. That was an easy one. He wouldn't wear his night guard either.
No, he wouldn't. He was very compliant.
But anyways, back to night guards. So tell us about the different options, and even in that regard.
Yeah, there's a lot of different options for night guards too. And dentists get they'll get very defensive over occlusion patterns people should have, and
occlusion patterns meaning
just how people should bite.
Okay,
and then even night guards is another one.
So there's varying opinions on how you should bite. In the dental,
I guess, or how you should set up someone's bite.
Okay, interesting.
And I guess that goes hand in hand with night guards, and how you should be able to function with your night guard at night to keep you going from out of excursive movements, or if it shouldn't keep you from going out of excursive movements where your jaw is sliding, I guess, more or less. And then there's some people that prescribe something called an NTI that just fits over your front teeth. And basically, it keeps all your teeth from biting, and especially keeps your back teeth from biting, and it keeps you from activating certain muscles that can cause those really those tense moments. But there's a controversy with that, because they say if you are just putting a night guard on your front teeth, and in the middle of the night, teeth like to touch, and so then your back teeth are going to start growing over time.
Say it again. They start growing over time.
Or not growing, they'll erupting.
Okay.
And so
it's like, wow.
They get bigger. But teeth like to touch. And so if someone loses a tooth, it'll try to fill in by teeth. A tooth from above will try to come down, and the teeth on each side of it will try to touch. So teeth just like to touch. And so at night, if you're not wearing that, the teeth will be possibly are erupting. But I think proponents of NTI say that during the day, you're not wearing it enough for that to happen, because then during the day, you'll mash them back into place, more or less. And so we used to do NTIs, but now we're doing just full night guards, because we just feel that's a better way to go. There are some cases where we'll do an NTI if someone just can't keep a full night guard in their mouth, if they think it's too much.
The other thing that we considered too in treatment, if somebody, let's say somebody has a night guard and they're clenching at night, is the question that I always like to ask is that next kind of level question is like, what's going on? Like, why are you clenching at night? And like, is that just a habitual thing that you've always done, or like I mentioned my example of like when I started the business and just having more stress. Like, is there a lot of stress and anxiety, or maybe depression, or just something in that regards, some psychological like mental wearing that is influencing tension overall at night? So
yeah, it does come with more. I do ask them if they do have stress going on. Mm-hmm. It's more prevalent in women to have that clenching and TMJ disorders going on, and so it does have certain patterns.
So what we like to help people with, like above and beyond of night guard, is also like, how can we find ways to relieve stress, anxiety, and tension? One of the best ways is exercise, and there's other ways too. Just being in good company, enjoying pleasure of a good friend. Just even, and when I say exercise, it could be something as simple as getting out and just going for a walk, like getting some fresh air. There's other ways of doing some like some mindfulness or meditation, some prayer, reflection, even just like what's going on preceding like your nighttime routine, right? Like, are you watching the news, which is filled with a lot of stress and anxiety? And, we're recording this during the middle of, just had an election. COVID's, still rampant. But even if these things aren't going on, it's still like the news is usually reporting on, things that's going to, provoke people's emotions of, bad things that are happening and problems that are arising, which is going to have an effect on you. And like, if that's happening, I would encourage you to just think about, maybe it's on Facebook too. If you got some friends on Facebook that are just, Debbie Downers, or just, posting, like, it might be something like, if you want to be on Facebook there before, in the evening, before you go, to bed, is, are there people that you need to block that's leading into just this level of anxiety or tension, before you go to bed. But those are some things to consider, especially if you have, pain, if the clenching is a factor. There's, some people, if, you have a little glass of wine, it can relax you a little bit. There's other exercises that you can go through as far as, there's mindfulness apps that are out there. There's tons of them. It can be as short as 4 or 5 minutes going through some contract, relax exercises just to try to really just clear out the mind, find a more restful, peaceful state. Even thinking about, the bedroom, how do you protect your bedroom, from clutter, from kind of stress? Like, what can you do? There's things that you can do in that regard as far as how you design that can just lead to more peaceful environment, if that's something that influences your pain. If you're dealing with a more complicated issue of TMJ, and likely if you're listening to the podcast is because you are, right? You're interested in the topic because Simple Solutions haven't resolved it yet. And so what we find as well is that there's this conglomeration of symptoms, maybe stress, anxiety, neck pain, headaches, maybe other areas of pain too, back pain. But oftentimes neck pain, headaches, and TMJ go together. And so what we find, if that's the case, what I'd encourage people, for is to really resolve TMJ pain. With our treatment approach, we don't start at the jaw, because usually the jaw, it's the last thing that'll go, if you will. Like, people have this history of neck pain and headaches, and then TMJ develops next, because it's just like it's the progression almost of the area of the body. If we can consider the head, the neck, upper body, like, it's just a progression of the syndrome. It feeds into TMJ, and so if you start with the end. As far as the jaw, you're really missing the whole point of what really transpired, what got you into this position in the first place. And for most people, starting with the neck, working on the neck, figuring out why there's neck pain, and which can lead you from there, can lead you to the mid back, which can lead you to the back or the shoulders. Like, every case is unique and different, and depending on how you move or what injuries you've had in your past, how are you in a sedentary job? Are you sitting at a desk at a computer? Are you doing more of a laborious job? Do you have to do more lifting? Do you have a child, a young child, an infant? Are you a mother that has to carry, that's nursing and having to carry, hold, nursing infants? There's so many different scenarios that changes how there's tension in the body. And ultimately, that will create abnormalcies of how you move and asymmetries in how you move. And eventually, the body starts to compensate with the differences in pressure and tension. And oftentimes, the jaw or TMJ is just kind of the tip of the iceberg, if you will. And what you have to really do is dig deeper to resolve at the very least, the neck. But oftentimes more than that, we have to really look at the mid back, the shoulders. And if you just start with the jaw, what I find is people will probably get some relief, but it's either won't be a full, complete relief, or within a matter of days or a few weeks, like, the symptoms will come back because the root of the issue hasn't been solved, which is likely just another area of the body that needs to be in a better position so the jaw can move. That's a little bit of just a snapshot of how we look at the body. And ultimately, oftentimes you need assistance, like if it's a more complicated case, of as far as working with a few professionals, for the TMJ, somebody like Dr. Nathan, if you need a night guard, right? That can be an easy solution. You need to look, or also work with a physical therapist to really put other pieces of it together. Do you need a consultation? Do we need to make sure that there's nothing going on with your ear? A psychologist, potentially, if there's like a high degree of stress that you need to, work through. So oftentimes it's, 1, 2, or sometimes 3 of these professionals that can assist you in the areas that you may need some help. We mentioned earlier about with somebody with more minor symptoms to using some ibuprofen, right? So one question that will be asked is, will pain medication cure my issue?
I guess when you take it, it will for a short time while it's working, but it's not it's nothing you want to be taking to try to cure your back pain. It'll
TMJ
mitigate
pain.
What?
TMJ pain.
TMJ pain. or back pain.
We can bring you back on if you have on the back pain one, if you got some.
Or back pain. It's just not good to be taking that pain medicine and get dependent on it if you're trying to alleviate your pain, because then you're going to open up the box for just worse issues.
For a short period of time, if you need some relief, hopefully just over-the-counter, medication can give that to you. But ultimately, Dr. Nathan was saying, once the medication's worn off, if it comes back and you need to continue to take it and take it and take it, then really it's just a Band-Aid. it's not solving the issue. It's not curing the root cause. If it were, then you could take it for a period of time and then stop taking it, and it would stop. Wouldn't be there anymore. And occasionally, minor cases, and maybe like that, the body can work its way out. And like we said before, take a little rest, use some warm compress, a little bit of massage, take some ibuprofen, and if it works its way out, then you can be grateful that your body's kind of found a way to work out the kinks. But if that hasn't happened, then I would just encourage you that continued use of pain medication, ibuprofen, is likely just going to make the matters worse, because you're just kind of kicking the can further down the road. And eventually something else is going to give until just the pain's more intense, or you have got to take it more frequently, the medication, or the medication even, stops helping you, even when you're under the influence of it. A few other things just to leave you with. One is, we've talked about the nuance of TMJ and how it is ultimately a complicated joint, and a lot of people suffer for a long time, oftentimes unnecessarily, just because they haven't found the right person to help them with. And one thing I like to just advise you with, if you're listening to this here around Knoxville, obviously we have a clinic here at Simply Physio that we specialize in the joint. If you're not around Knoxville, one thing I'd recommend, and I've just seen it just over the course of my career, is seek out a professional that specializes in working with the jaw, whether that be a physical therapist or like Dr. Nathan here, like he tell you that he really doesn't specialize in TMJ. He can help you when it's more of a simple case, or help get you fitted with a night guard, and help in that regard, help to diagnose and to point you in the right direction. But there's specialists as far as surgeons, oral surgeons that specialize in TMJ. But the same way with physical therapists, if you're looking to avoid surgery and you don't want to go down that route, there's a lot of physical therapists out there, but not many specialize in TMJ. And so I would just ask, if you're seeking care from a physical therapist, is one, don't just ask if they treat TMJ, because everybody will say they do, because everybody has had a basic level of education in PT school. And we've just recently been interviewing PTs for a position we've had open here at Simply Physio, and the topic came up as we've been interviewing PTs of like, hey, TMJ is something that we specialize in. Do you treat TMJ? And most PTs would say like, hey, I really haven't seen many cases of it. Occasionally I'll see a case, but whenever I do, like, it's so far in between that I have to get out my books. I have to go back to my notes from college and just do a little bit of refresher, because it's been so long since I've seen it. And so just be sure you're doing your due diligence and finding a therapist that doesn't just take on a case, but actually specializes in helping with TMJ, because that can be a huge difference in you finding results. We do have here at Simply Physio an ebook on solving TMJ, where I actually have recorded some exercises you can do with a link. Go over some top other recommendations, some things that you can be on the lookout for. So I really leave you with my top 8 tips that I regularly give my paying customers, but that I'm freely offering to you guys. So go on the website, simplypt.com. That's simplypt as in physicaltherapy.com. And at the top, you'll see an icon for physical therapy, and there'll be a drop box, and you can click, you'll find TMJ. And on that link, there'll be an option to request the tip report, the ebook for my top 8 tips for solving TMJ. So be sure to look out for that, and I'm happy to offer that to you. Just let me know if you would want that. So leaving here, the end of our podcast, we got a few questions here for Dr. Nathan. Dr. Nathan, tell us, we always like to encourage people to explore Knoxville, wondering ways that you've explored recently. So you have a favorite restaurant or a new restaurant that you've enjoyed eating at that you would recommend for others to try out?
Yeah, I guess my My favorite restaurant around Knoxville is, I think is it pronounced Cafe?
Cafe.
Keefe?
One of the two.
Or is it any of those? But it's downtown Mediterranean. It's really good.
Yeah, and it's right next to Barley's.
Yeah.
Down in the old city. So I would second that as well. Next question is, tell us something on your bucket list around Knoxville that you would love to do here, to explore, to get out and enjoy that you haven't.
I guess it's the greater Knoxville area. So it's Sevierville. It'd be fun to go. Skydiving would be one. I don't know if Sarah would let me do that.
In Sevierville?
I don't know, wherever they do that.
Okay.
They do it around here.
And if the sky is nice in Sevierville or something.
Yeah. I guess they have the
Smoky Mountains,
the tourism to do it.
Yeah.
Or go down one of those balls down the mountain.
All right. One of those inflatable things is on your bucket list?
Yeah.
Okay, that's a new one. I haven't had any guests. I guess you can probably do that in Sevierville. You can do
There's a lot of mountains.
Strange things like that. While we're talking about Sevierville, something maybe less, I don't know, weird. If you're not into putting yourself in an inflatable ball and rolling down a hill, is one of those mountain gliders. You know what I'm talking about? I think that's what they call them. The roller gliders, or there's a bunch of.
I don't think I've seen that.
They've popped up. That's around. I may be off on the term. I think you can find out what I'm talking about I'm sure if you do a search. But I know they have them in Gatlinburg and Sevierville. But it's like a little rail coaster. And it's not they take you to the very top of the track, and you get in this single cart. Sometimes I guess it could be a double cart, and you go down the track on this little rail, and I think you have a break. And yeah, it's something that is
like a roller coaster.
Kind of, but it's not like you're not in a cart like with a bunch of other people. A mountain alpine. Or have a
mountain alpine coaster.
Mountain alpine coasters, you can find it. So yeah, something to check out. It's I've seen them building them more and more around Gatlinburg and Sevierville here the past few years. Next thing, what's one of your favorite things to do around Knoxville, outside, a place to explore?
I enjoy swimming. This summer it was fun. I went with a bunch of people from F3 and my dad, and we went to Fort Dickerson and swam in the quarry there. It's a real pretty quarry that a lot of people don't know about. Inside, I definitely recommend going out and checking that quarry out. You can find some interesting people there. But just don't go at sketchy times, I guess.
Don't go at dusk.
Yeah, probably. Don't go at dusk. Probably go there on the weekends more. Don't go there on the weekdays. But it's cool when you go there. It's a really pretty place. So
okay. Awesome. All right. And last question, Dr. Nathan, what would you leave our listeners with the top tip for staying healthy, maybe in regards to TMJ?
I would try to go for the least invasive options for treating that pain.
Right. And a good option would be potentially seeing somebody
like a physical therapist.
Exactly. Do you know any physical therapists, Dr. Nathan?
Yeah. Right in front of me.
Man, I had to pull that out of you. So much for the brotherly love. But yeah, we here at Simply Physio, we'd be happy to talk with you more about our approach if that's something that would benefit you and that you're looking for. So yeah, Nathan, thanks so much for coming on the show.
Well, thanks for having me.
And stay healthy, Knoxville.
Thank you for tuning in to the Stay Healthy Knoxville podcast, brought to you by Simply Physio. If your pain is preventing you from staying healthy and active, and you'd like to avoid surgery, pain medicine, or just want to get back to doing the things you love in and around Knoxville, we offer both a free ebook and free over-the-phone consultation to help you figure out the root cause of your pain and the next best steps for resolving it. Find our ebooks online at simplypt.com/health-tips. There you will find ebooks for topics such as neck and shoulder pain, lower back and hip pain, knee pain, and TMJ. These quick-to-read reports will provide you with expert tips, tricks, and exercises to help solve your pain from the comfort of your own home. Just visit simplypt.com/health-tips to download your ebook and have it delivered directly to your inbox. We also offer free, no-obligation phone consultations with a doctor of physical therapy to Knoxville area residents. Just call us at 865-351-0615 or visit us at simplypt.com and click the Talk to a PT button on the home page to schedule a call with us. Thanks again for joining us, and we will see you next time on the Stay Healthy Knoxville podcast.